just going to wait another minute or so, and then we'll officially start. And as people show up, people show up. I think there's 4 or 5 people on the committee. So we'll see who actually shows up today.
I have your list. Bob, do you have your list with you? I have the list in front of me.
I don't have the full list, no. I don't have the full list.
Okay, I have you as chair, Sebastian Pilly, Margaret Della, Steve Fruit, Barbara Kale, Omar, and Community Committee member Kimberly Alley.
Kimberly is here.
Kimberly is here. That's the list. Hi, Kimberly. Did any of these people call or notify the board that they were going to be absent? I don't know.
I did not hear, except for Omar, who is online right now. No one else, I've been informed, has
Right.
that they wouldn't be here.
Barbara Kale, I see she's a new member. It's a big adjustment coming back in person. It's a big adjustment.
It's a big adjustment, and I know that some people are not fans of hybrid. I have no problem with it. I've conducted major coalition meetings in hybrid and conferences and all kinds of stuff. So
my hat's off to you. I didn't know what level.
Well, I have I've had over 500 people on Zoom sometimes, so it's really not a problem. So we're going to start, and it's on recording, so those who have not shown up yet or will show up, hopefully can view the recording. First of all, my name is Bob Kaplan, Rabbi Bob Kaplan. I am the new chair of this committee. Omar Murray preceded me, and I attended this committee for 2 years and found, and healthcare is probably one of the most important issues to me, and from certainly from a social service point of view, and from my organizing history as well. What I do professionally is I am the executive director of an organization called the Center for Shared Society. It's part of the Jewish Community Relations Council of New York, and it is dedicated to bringing together diverse leaders throughout New York City to be able to work together to solve problems together. And healthcare has been a very big issue for me for over a quarter of a century. Our center has founded at least a half a dozen major healthcare coalitions in New York, in Brooklyn, and the Bronx, and Manhattan. Our latest venture into healthcare has been around the issue of healthcare disparities, as the Brooklyn Coalition on Healthcare Disparities. Right before that, right before COVID, we had an ongoing coalition around immigrant health in Queens, because many immigrant populations and immigrant aging, it's their first encounter with aging in the American system. And they come from other places in the world where the aging system is usually radically different. And again, it's the aging system encountering them and them encountering the aging system. And one of the things I just have to say, one of the most important things we learned there is that what most of us take for granted as a very profound safety net for seniors in the United States, Medicare, Medicaid, Social Security, et cetera, is not available to many folks who have come over here either from history of being undocumented or not working 10 years within the Social Security system. If you don't work 10 years in the Social Security system, you cannot get the normative benefits of Social Security or Medicare that are offered through that. And it really puts a lot of people, particularly new immigrants or immigrants that have been here for a while that did not participate in those systems, at an incredibly disadvantage. One of the symbols of that, a tragic symbol of that, is to see folks in their 70s and 80s and beyond walking around the streets of New York City collecting bottles and turning them in and to have some sort of income. It is tragic. And one of the things we certainly learned during COVID was, and just to give you some of my other healthcare credentials, I sat on the board of one of the major HMOs, Health Plus, before it was privatized, for over 15 years. I sit now on the board of NYU Langone Brooklyn. I previously Lutheran Hospital, and I also sit on the board of their Federally Qualified Healthcare Center. I've taught at Emory School of Public Health, so I have a deep history of being involved in healthcare. And I really felt that this was an opportunity for this as a community board to take a deeper dive into some of the issues that are affecting the health of those who live in the community board, certainly in the Bronx in general, and of course in New York City. Everything is interconnected. Everything's interconnected in the context of New York. So that's some of my history within healthcare. I'm going to do the roll call. I mean, the only person I see here is Kimberly. So, and Omar, is that you on the screen there?
Yes, I'm here, but I'm traveling, so I'm listening.
Okay. So Omar is my teacher and somebody who has taught me how to navigate this particular committee. But as you've heard, I've been involved in healthcare, been organizing around healthcare for quite some time. Why don't you join us at the table? I think there's some seats here. Some of the folks did not show up, so no reason you can't join us at the table. Okay. A couple of months ago, somebody else is here. People here, let's see who's here. Okay, so we've been joined by join. Okay. We've been joined by Steve Fruit. Is that working?
My apologies. The agenda I'm holding in my hand says 7:30 start time. So.
Oh, okay. Then there was a little complication because we'll make sure that we take care of that in the future. And MD, who is MD? Margaret Delia.
Yeah, same issue for me. I was expecting
Okay.
a 7:30 start time.
Totally understood. And right. I guess what was sent out to you was says 7:30. The agenda here is 7. So we'll make sure that we get that straight in the future. Thank you for joining us. And just to give you again a little background, I have a long history in organizing around healthcare. I sit on the board of some major medical systems here in New York and have sat on the board of major medical and HMO systems for quite some time. Something I didn't mention before, I've done a lot of consultations with Health and Human Services down in Washington, D.C. around these issues. I sat on a major committee, interesting enough, on pandemics. Literally right after the anthrax pandemic, the anthrax threat, it was sort of startling to us who did a lot of planning. Many of you may have heard about, there was a whole plan in place under previous administrations on how to handle pandemics that was sort of thrown out at the beginning of the Trump administration, and there had been real planning put into place on how to handle pandemics. It's a tragedy what happened. However, I'd like to now introduce Dr. Nancy Keck. Nancy is the Director of Health and Human Services at the Bronx BP's office. She's here to give us an overview on the BP's, Vanessa Gibson's, healthcare priorities. We're going to ask her back and some of her staff to take a deeper dive, but we wanted to hear some of the major issues that the borough president is concerned about for the borough. And that will lead us into a discussion here for those attending of what we'd like this committee to achieve over this next year. What issues we'd like to delve into, what other kinds of discussions we'd like to have here, what some of the takeaways that we can begin to look at, fully understanding that we've done this in the past, but we're going to take, like I said, a little bit more of a deeper dive into the issue of healthcare in Community Board 8. So, Dr. Keck, please, the floor or the screen is yours.
Thank you, Rabbi Kaplan. Before I introduce myself, I wanted to ask, I had sent you a one-page front and back synopsis, like an outline.
Right, we're going to make that available. We're going to make that available, and all the links we'll make available in the notes that will come out of this meeting.
Very good. Thank you. I appreciate that. Greetings, everyone. Thank you for having me. It gives me great joy and pleasure this is my first community board presentation. And I think it's a wonderful idea to join the health committees and other committees for whom a lot of the information that I'm going to talk about is really relevant. In the event that we do come back fairly soon, I have a colleague who's the director of policy. We have this amazing document that we drafted in the first year of Ms. Gibson's tenure as borough president. And it was really designed to outline her goals for the borough at large, across every domain and division of the administration. And it's readily available. Rabbi Kaplan will share the link for that. And in addition to that, there are a number of newsletters that we have generated called Bronx Health Matters. I will mention those in a moment. So I'm happy if you make those available. Those are crucial resources for community. That's what we developed them for. A little bit about me. I am a PhD from NYU, actually bachelor's, master's, PhD from NYU. I also taught there for many years, and my background and expertise was in neuropsychopharmacology, essentially drugs in the brain. And then I went to Mount Sinai School of Medicine for my postdoctoral fellow, and I taught there for a number of years and became a medical educator and a mini dean, which, and spent like another decade working in the medical school, which I really loved. And then ultimately I moved on to do, I got an MBA in quality management and healthcare management, and I began to work on how to measure quality of educational institutions for licensure. So a little bit more specialized. And I've recently come back to doing public health work and my true passion in the borough president's office. And that's what I'm going to tell you all about. So all of the things that we do, and there are about 6 or 7 pillars that really are the highest priorities for the borough president. And the way that we choose what we work on is not because we're interested in something, but because everything we do is truly evidence-based. That means we look at data from the Department of Health at the state and city level, and we determine from the numbers that they present and also other metrics that I will mention that are really of interest to anyone who wants to know about population health. We look at the numbers for lifespan and really key essential health outcomes, and also things that are called social determinants of health. And one of the huge committees that I spent a lot of my time working on, in fact, the first thing that I worked on when I came and joined the borough president's office, that was in early 2020. And a few weeks after I joined, COVID happened. And I really hadn't had much anticipation or preparation for a pandemic and all the emergency management. But I served on this committee called the Not 62 Campaign for a Healthier Bronx, the founding members of which are the Bronx Department of Health and Mental Hygiene, Montefiore, Bronx Health Reach, and a number of other core institutions. And we really worked as a tight team to navigate how to manage public outreach, public health literacy, and really doing a lot of the work that was required during the pandemic. So I can tell you one of the first priorities for us was racial and ethnic health disparities. There are a huge number of health outcomes that are incredibly poor in the Bronx. As many of you know, the name of the Not 62 Campaign for a Healthier Bronx really evolved from the fact that Robert Woods Johnson does a county health ranking for New York State. And of all of the counties, there are 62 counties in New York State. We in the Bronx rank at the bottom, the very, very bottom, number 62 in terms of health outcomes. And they also show health factors, things like that influence health directly and indirectly, housing, economic status, whether there are, single family households, what type of housing you live in, whether it's in a house or in a public housing or in a different kind of housing setting. All those things really influence health, as does your zip code. Where you live really does influence health. So that became a really important focus. We do a number of health outreach, annual events, individual events, partner events, and publications. We're very interested in ensuring that people in the borough have access to significantly good primary care providers, wraparound service, and we're very attentive to population health. And the borough president, through her capital funding initiatives and the collaborations that we have with the 7 hospitals, if we include the Bronx VA, in the Bronx, really focus on those social determinants because they really have a high impact on the quality of life, our lifespan, and definitely a lot of our health outcomes. So one of the most important things that we do is health fairs, health outreach with partners. We participate in an excruciating number of public events in order to promote health literacy and to really bring resources into communities that need additional support and help in terms of connecting to providers, resources, and other forms of important access. And one of the things that we've done since I came on board is it really started as a student and intern project, was to create a health newsletter where we can really talk about what the office does, what we consider are our top priorities, how we work on those, who our partners are, and really highlighting in-depth information. So that is called Bronx Health Matters. We started that last year. And I think in a time and in a world where everybody does a lot of social media and really puts out a lot of information in small tweets and posts, it's amidst a vast amount of other information, and that is not permanent. And that goes because the next day there's 10 million more people tweeting and commenting on important topics. What we look to with the newsletters and with some of the public reports that we work on is to really have an enduring, in-depth view of what is important to the borough president's office, to the borough at large, what are the most compelling health problems, and then sharing those in terms of small feature articles, interviews, and analyses. And we like to promote a lot of data. And almost all of the work we do on health is done through a series of committees. So I'll mention them as we go along. One of the top health challenges in the Bronx, and has been for decades now, is diabetes. It is an illness that comes from the way we eat. It is highly preventable, and yet it is the #1 illness that plagues our communities. Most importantly, the numbers are more staggering than ever. the health department released some data, post-pandemic data, that showed that in some communities in the Bronx, 1 in every 4 people has been diagnosed with diabetes. And moreover, that's just people that we know. There are people who have never been tested. There are people who are pre-diabetic and are not aware. And so there's a huge avenue for public education and prevention there. And we are assembling a borough-wide task force, group of experts to help us problem solve on how we can really communicate public outreach and with our health partners on food as medicine and how to impact, that problem, that challenge, how to address that challenge in the Bronx. In relation to that, we do a lot of food justice work because in addition to the fact that there is food insecurity where people do not have sufficient means or sources of food, sometimes children go hungry if they did not have, breakfast and lunch at school. That may be their only meals of the day. And in addition to that, nutritional insecurity. So those are 2 things that we are really focused on. We do with partners, with the mayor's office, with the food policy division, and with a lot of our partners like Bronx Health Reach, Hunger Free America. We have a Hunger Free office in the Bronx now. We really work with those agencies and community organizations to amplify and promote the programs and the entitlements that people could get and that are available. Health Bucks, SNAP benefits, fresh, innovations that are happening at the Hunts Point Market. There are many places where we are looking at food, sources of it, fresh, healthy foods, partners like Grow NYC who have the green markets, and also others that we are working with. In particular, we pay close attention to the community gardens that are in the Bronx. A lot of them are urban farms. And during COVID, when we really had to scramble to look at how to fill the voids during a time when stores were closed and there was a great need for dissemination of foods, we really worked with a lot of the community gardens and the Bronx Food Hub. We honored them. There were 18 gardens that grew at a huge amount. I can't even tell you how many bushels or whatever the weight of produce is, and shared that, for free with pantries and with houses of worship where food was given out throughout the pandemic, fresh produce, fruits and vegetables from those gardens. So we really look to those partners in the borough that are doing that work on the forefront of urban farms and really like Bronx Health Reach. And I should mention tomorrow, I will send a link. There is the Bronx Health Reach is having a food summit since they participated in the White House conference, and we supported with community listening sessions to find out how families, what kind of help they need, what would help them access more of the programs. And that is an amazing organization. We love them and we work with them very closely. The third large pillar that the BP has been active for many, many years, long before she became borough president, Ms. Gibson was, as a council member, very much invested in maternal health. In the Bronx, we also lead in maternal mortality and morbidity. That means death and injury to moms when they are delivering babies. That is really a tragic, situation to lead in that. Between us and the Northern Brooklyn, invariably we are either number 1 or number 2 in the city, and actually even in the state in those numbers. It is, most unfortunate. There are a number of committees and organizations that were developed to really look at that problem in our borough. There have been task forces at the city, state, and CDC level to really look at the problem. And it seems it is pervasive. It is nationwide. But in our community in the Bronx, as the poorest congressional district in the nation, it's one of the ways in which you can see how the social determinants of health can really impact outcomes, such as birthing outcomes. So it has to do with access to resources, housing, and many other things, and in particular, really high quality health care, and in particular, prenatal care, care at the time of birth, coaching and support, and then postnatal care into the 4th trimester. And we are working on many ways in order to promote opportunities to support low-income moms and families that need that additional support because they cannot afford it. We have created a borough-wide consortium. We are building it now in order to build community advocacy and funding around maternal health and, to look at these problems. And we are also at the moment looking to disseminate imminently, not immediate, but we're working on a Bronx Birthing Center report to look at potential solutions and things that have been shown to really help diminish poor outcomes for pregnant moms. So we also work closely with Bronx Health Link and support their work as a hub for maternal health services to really help provide free services for moms around the borough. Doula care before, during, and after birth is one of those examples that the Bronx Health Link provides. And we work with really innovative providers like the best example I want to give you is the Woombus Initiative, which is an innovative mobile doula care model where the bus goes to the point of where the mothers are in order to help them with education and postpartum, questions and support and mental health assessment. It is an amazing resource, and we are looking to support people who do really innovative work like that. Our next huge pillar is domestic and gender-based violence. We work with many partners, most notably the Bronx DA's office and a number of other justice agencies, the Department of Probation, and organizations like Safe Horizon and the DIVA group, the DIVA Initiative, in order to really raise awareness. We are entering October now, and it is an incredibly broad and pervasive problem. Violence is hidden very often, but it is in every community. And what we have found, once again, is that if you look at the precincts in New York City that report incidents of domestic violence calls in which they go to the home, or incidents of intimate partner violence, in the top 15 reporting precincts in the entire city, 8 of them are in the Bronx, and the top 3 are in the Bronx. That means in that aspect as well, in terms of domestic violence, we have the highest rates in the entire city. And that too is, I think, related to some of the challenges, socioeconomic and historic disinvestment, and a lot of the issues that come with poverty and with mental health and other challenges that we face as in our communities. We have secured a Department of Justice grant that was allocated to ourselves and the partners I mentioned earlier that is dedicated to strategies to reduce intimate partner homicide. And that is one area in which we are incredibly active. For the entire month, we would be doing events. We're doing 31 days of DV awareness programming with ourselves, our partners, where we are either supporting, promoting, participating, and what we want is for the borough at large to have trainings. We have initiated trainings with faith-based organizations, with community organizations, pantries, all manner of partners and health partners around the borough. And we feel that the more awareness there is, and when people actually see how violence manifests itself in communities, that people will really act and help to notify people that they suspect need help, and to also teach it at the school level and in houses of worship that that is not an acceptable outcome for families. It really destroys families, and we want people to know that there are excellent resources, emergency shelter, housing that is just for DV survivors, and many, many, many organizations that are working together to really look at that problem holistically in our borough. What's important is we have a DV advisory council. We have about 83, 85 now members, and it's really a cross section of New York City agencies, Bronx agencies, advocates, ones that are providers, service providers, health orgs, and even private organizations and private individuals who do this work with great passion and tenacity, because it is something that needs to be diminished. We also, I personally serve on the Bronx Human Trafficking Task Force as the representative for our borough president, and we do significant work around advocacy and work with a lot of medical providers who support and treat people who have been trafficked and have been injured in very real ways and victimized. So that is grim work, but it's important. And it's also incredibly important to talk about it and to educate communities on how to see that, because it happens in hiding in plain sight. And that's important. We need that. Moving on, we are also moving in. So as I should say that our health team is a team of 3, now 2, because one of my staff members has just started medical school at Mount Sinai, I might add, my alma mater. So it's really important to have significant external relationships to really do this work at the community level. And that's really one of the ways in which we're able to get a lot done. Despite our small team, the other thing that we are looking at with great seriousness are 2 additional epidemics that seem overwhelming, but there are really important ways in which we can support community. One of which is the opioid crisis. In our borough, we also have incredibly high numbers of overdoses, and young and middle-aged and even older individuals who are homeless because they are substance users and have lost their dwelling, their family support, their jobs, etc. Very often those individuals have underlying mental health issues, and that brings us to this intersection where many of the problems are linked. Nothing stands in isolation. It's important to look at all of our societal issues, whether they are family violence, whether they are mental health and substance use disorder. There is often an intersection, and we very much are working with the city on some of the initiatives that really help support mental health services. In particular, we're very eager to expand and promote the mayor's initiative that when someone calls 911 or 988 now, there is a new emergency mental health hotline, but people still call 911. And instead of a person who is in a psychotic state and really needs medical attention, instead of them being victimized or the subject of violence themselves or getting shot because they can't respond to commands, there are special units now that send a mental health worker, a community health worker, along with a 911 EMS responder that actually has training to de-escalate a situation when a person is in a mental health crisis and not able to function properly or obey commands, the things that lead to, real tragic outcomes. So that is one. We very much want to bring those programs into the communities that are most, that have concentrated pockets, like in areas of the South Bronx around the hub, where there are really like high pockets of individuals who are unhomed, mentally ill, and very often trying to self-medicate through substance abuse. In addition, we also do a lot of advocacy for vulnerable communities. We have a historic committee that is the HIV Roundtable in the Borough President's Office. We coordinate now with borough-wide, citywide, and statewide institutes and agencies that deal with AIDS, HIV and AIDS. And we meet regularly. Those meetings are incubators for policy and action. And we do a tremendous amount of outreach, and we dive deep into communities to embrace the LGBTQ plus community as well as, everyone. And we recognize and honor the work of health providers, like, for example, Gotham Morrisania has a legacy HIV program that just celebrated 20 years, and they serve the needs of individuals that have lived with HIV and thrived for decades. So that's really important work. And there are a lot of amazing programs throughout the borough that support that community of patients. We also do advocacy for sexual and reproductive rights. We are formulating, restoring, and have been populating a disability council. That leads me to mention to this group as a whole that we welcome community members that would like to volunteer to serve on the Borough President's Disability Council. You can reach out to myself or our Director of Community Services, David Coulibaly, who used to be the Borough Director for the Test and Trace Corps with the Department of Health. And we are actively seeking volunteers to serve on the Borough President's Disability Council. Lastly, there is a very huge environmental justice component. This is our last pillar. We support distressed communities. We support projects that help address environmental problems that have plagued our borough for a very long time. And I'll break them down just really quickly. It is no accident and no surprise that we are called Asthma Alley, that all of the communities that live in proximity to the Cross Bronx Expressway are really epicenters of asthma in the Bronx. As such, there's huge movements underway to cap the Cross Bronx and to really look for federal infrastructure money to help create green spaces and coverings, over that large expressway in order to help rejoin communities and help clean some of the air in many ways. So that's not something we are directly involved in, but I can tell you that we are currently also seeking members to support the next project I'm going to mention. New York State DEC, Department of Environmental Conservation, and ACLIMA, which is a public-private partnership, are really conducting broad-scale air quality monitoring. And it's a pilot project that began last year in July. And they have spent 1 year collecting data. Many of you may have seen the Prius special cars that say ACLIMA and New York State DEC. They have been going block by block by block throughout the Bronx, collecting data. They have $1 million plus mass spectrometer in the trunk that takes in air and that analyzes it and basically assesses the presence of particulate pollution, so small particle matters, as well as 5 greenhouse gases. And that is really the source of most of the pollution that comes from vehicles, cars, and other forms in community. And that project is exciting for us for 2 reasons. One, it's driven by New York State, it's a pilot. And all of the other pilot areas are like some are in Albany and Syracuse. One is in northern Manhattan. One is near JFK Airport in Queens, but the Bronx as a whole is considered a distressed community. So we aren't technically the entire borough is being measured. And I'm passionate about creating a community advisory board. We've been asked to convene, New York State has asked us to convene people from the community to really look at the data as it evolves. There is some preliminary data that's come out and I can share that down the line, but you can go online and you can see some of that on New York State DEC site. They record all of the quarterly meetings and they actually have already posted some maps. What's important for us in the Bronx BP's office is that we want community members that come from environmental justice organizations, from education, from health, and even from the business sector to help us look at that data. Because at the end of the year, when the map is complete, it's going to show us where is the really poor air quality, who is causing it, because when you see what the type of pollution is, you automatically will know based on what's in the close proximity, what its cause is as well. And we are very eager to create policy around that. So that if it's a business and, that's one thing, that we have to figure out how to create policies that would really look at, who are the individuals or entities that are doing that. And also we know that traffic, the interstate traffic that is coming through, major source. So think tank, ideas and really looking at policy, that's something that we would encourage people who are interested in air quality. We are actively recruiting and we would, I will send out information on that too. Lastly, we support a lot of projects that are electrifying. There are grants and things that we have really promoted, particularly in Hunts Point, where there's going to be a shift over to all electric vehicles from the big diesel trucks, and to also push for funding for the charging hubs that those trucks need to make all of their local deliveries throughout the city. That is a huge initiative that we are strongly supporting and actively monitoring, following. We also have emergency management responses to toxins in communities. We work on Legionnaires, lead, mercury, etc. Whenever there are outbreaks of Legionnaires, and they happen very regularly every year, there are cases, and we work closely with Department of Health on those. There is also something called the Solid Waste Advisory Board, SWAB for short.
So
we're
going to be able to take a deeper dive, and we
Okay.
have a, yeah. I'd just like to move the group on a
Absolutely.
little bit. No, I don't mean to
No,
cut you
not
off,
at all.
but there's
That's
Um,
good.
we're
We're on the
gonna be-
last
hopefully
one,
we'll-
and we can leave it at that. There's a lot that everyone can read about. Some of the most important things in our strategic policy statement, on their own. And now that we've connected, I would very much like to send ongoing information to your constituents so that we can, work on things together, things that impact your communities.
God willing, we will develop a deeper connection between the Borough President's office and the agendas that you've outlined. We're going to take a deeper dive in, and we will make available to everyone on the committee the links to the reports, and as you send in different pieces of information to us, we will make sure that we get that out to the community on a regular basis. And that's the amount of major issues that you've really outlined here is incredible, and it certainly also mirrors the one major fact that you brought up earlier, is that out of the 62 counties in New York State, the Bronx is the lowest on the totem pole, so to speak, lowest on the rating chart of healthcare in the state. And that's something I know that the Borough President and others are very dedicated to changing, and hopefully that we can be a full partner in meeting some of those challenges in the context of the Bronx as well. I'd like to open this to some questions for the doctor, just for the next few minutes, if there are any questions, and then we'll go on to the next piece of our agenda. Are there any questions for the doctor?
I have a couple of questions. Hi, I'm Margaret. I'm one of the committee members. I guess I have two questions. One, I guess it's the number one reason for bodily violence in our district, as well as for homelessness in our district, is domestic violence. We've also seen, first responders in our neighborhoods who have been murdered by their partners, et cetera.
Yes.
Those are two monumental areas within our district, and, certainly we're grateful to have some understanding of where violence and the instability is coming from within our district, but it just feels like we're not necessarily moving the conversations enough so that folks are getting information in the district. And I was just wondering, I heard your presentation and certainly some of the efforts funded by the DOJ, et cetera, and I was wondering what else you all are doing, and things that we could be doing in a more overt way to raise the issue of domestic violence and intimate partner violence in the district, and where people can go for resources.
I'm glad that you asked that question, because one of our strategies was to really, as I mentioned at the beginning, we are data driven. So in community boards 3, 6, 12, 1, we have some of the highest rates in the borough. We want to actually concentrate trainings and outreach and come to community board meetings like this and have people do trainings. Because what you find is, I personally have never worked in DV before. I started a year and a half ago to really focus on this as a health pillar. And what I realized was, after the first training, I could never unsee what I'd seen and learned. And what you find is that the signs of families that are in distress and the underlying evidence of violence is really staring many of us in the face. You just don't recognize it until someone says, that's what it looks like. And when you speak to survivors and when you have events that really raise awareness, and also about resources and ways in which you can approach someone and offer an ear, support, information, that's important. So we're happy to help with providing trainers that come from either the Bronx Family Justice Centers, and we have some specialized trainings that come from community-based organizations, for example, on trafficking, survivors of trafficking, people who were children of 12 years old when they were, removed from their homes and tricked into, servitude and being sold over and over again in a hotel room somewhere. And that should never happen to children. And there are predators everywhere that really focus on families that are poor, disarticulated, and where there is not a very careful eye on seeing, signs of violence. And we want to train teachers. We want to train clergies. We want to train community affairs officers to really see that problem through a very different lens. And I think that's important. That's the answer to your question, training.
Unfortunately, one of the issues that I'm very deeply involved in is gun violence.
Yes.
And everyone tends to think of gun violence strictly through the lens of mass shootings. In reality, mass shootings is the lowest. It's not the right word, but it's it's not the major incidents that happen in gun violence. The intimate violence is one of the highest numbers of gun violence that happens in the context of our society, coupled with suicide. Suicide is actually 51% of the incidents of gun violence within our society are suicide related, and of those, many are related to the issue of intimate violence. So it's sort of a jump into the next agenda item as well, the areas of focus that we'd like to be able to take within the community board and within this committee. So domestic violence and intimate violence is something that we will be turning to our president's office and other trainers, and perhaps doing trainings in the future, again, for community leaders, that these meetings are not merely to hear someone tell us what needs to be done, but become leaders ourselves in the context of getting the right kind of information to be able to meet these challenges on a very localized basis. Any other additional questions?
I have a question.
Yeah, please. If you could just introduce yourself.
My name is Debbie Allen. I'm an advanced practice provider. I'm a nurse practitioner. And what I've seen in the nursing home setting, what's happening in the community, there's a lot of now nursing home residents that have opioid addiction, they're violent, they're under age 60 now, they're younger. So now the nursing home industry is no longer with geriatric population. It's become, we see in our society, and they come with homelessness and all these other issues. Is the Borough President's Office aware of how the nursing homes are struggling to manage the population of people?
That's interesting. That is not information that has reached me personally. Typically, what we see is that there are individuals who contact us when they believe a family member, or when an individual themselves feels that they are being abused and they reach out to we have a constituent affairs office, the ombudsman office, that actually handles inquiries, requests for help, and we have caseworkers that actually go and help find resources for individuals when they call in all matters, not just health related. And so more often than not, we hear about people who are incredibly unhappy with the way they themselves or their parents are being treated. And that was at peak during COVID. It was an incredibly difficult time. I had hundreds of calls a month where we had to make calls and investigate and engage with the state and report to the hotline. But the other we had not. I would love for you to reach out to me personally outside of here to.
I would be interested if the 50th precinct is taking data on how many calls they respond to nursing homes.
Okay.
Not for 911, but because there was some type of altercation or drug observed on patients.
Yeah.
I tell you that's been a very unusual, but I see it more frequently.
Okay, thank you.
It's
That was a very
it's
important
another area. I know that we do have an aging committee, and it's, perhaps we could reach out to our aging committee and jointly look at some of the issues of aging, because it's often healthcare is the primary issue, and social service the primary issues that aging populations are encountering, and vice versa. So it's something else I think that there can be some additional work on. I can only imagine that the trauma that we've all been through the pandemic, and of course just the trauma we're going through on a regular basis, living in a society that is as toxic as this one tends to be, has evidenced itself. We see it certainly in the opiate addiction problem, but I don't imagine those who are seniors are any less subject or less vulnerable to the issue of opiate addiction as a way of an alternative way of coping, and I use that word advisedly, coping with the trauma of what the life is like right now. Any additional questions? Anyone on the screen have any questions for Dr. Keck? Okay, so I really appreciate it. Yeah.
I just wanted to, my second question, we had Shirley Lairo from Bronx Health Link present on maternal care in the district and how Black and brown women 9 to 10 times more than white women have a worse experience or worse maternal care. And I was interested in hearing more about, and then that's a national statistic, I shouldn't say just in the district.
No, you
because I don't have that kind of data. But
you were correct,
I'm sorry?
actually. In January of 23, that data was released by New York City Department of Health and Mental Hygiene in New York City. That most recent data was that if you are a Black woman, you are 9.2 times more likely to die in childbirth than a white woman. And that is current data for New York City. So, and that data comes from the Maternal Mortality and Morbidity Review Committee that was formed to actually investigate a multidisciplinary team every single episode of maternal death in the city of New York, and to look at the cause and whether it was preventable. And that is how we are able to really discern what some of the contributing factors are to these very abysmal maternal outcomes. You know, we can do much better than
I think, and as my neighbor was saying, it's about being listened to. I mean, especially, it could be DV, it could be intimate partner violence, it could be getting access to medical care. Like how, it's beyond training, sort of like what is the conversation in the borough around like hearing from community members how to understand what people are saying, listening to them in the moment. I certainly know it's a national tragedy and it's beyond just the Bronx, but anything in that way. I know there's a maternal ward that's, not ward, but birthing center that's sort of like this ultimate vision for what could happen in the Bronx, but is there something at a smaller scale on a more granular community level that the borough president is working on?
So the Bronx Maternal Health Consortium is really a interdisciplinary, everyone in the borough that has any job, role, advocacy around birthing and maternal health and maternal care is really invited to participate. We are looking to really create a robust advocacy body. I think something important that you mentioned that I wanted to sort of add to it is not just about that you're not listened to. What's really been shown through very rigorous data and research studies, going from the national level certainly to local, is that there really is an extreme form of systemic racism that segregates the outcomes for Black women, that things that do not happen to Latino or Asian or white women in a hospital setting. And very often people like to say, oh, it's educational level, it's people don't get good prenatal care. Very often what you find is that incredibly prominent, successful, highly educated, wealthy Black women have similar outcomes. And it really leads to the fact that we have to have a very bold and honest conversation about what that's about and why that happens. And that's just one aspect of it. And then there are, of course, the factors that having really good access to prenatal care, having a coach or a doula or a midwife that really works with you before, during, and after, those are important factors. But I have to say, the social component, that's undeniable. And we really have to look at that. And I'm actually quite impressed with the fact that the majority of women who lead hospitals, and particularly the labor and delivery, maternal fetal medicine, or the OB, obstetrics gynecology departments in hospitals in the Bronx, happen to be Black women. And I didn't even have to ask or invite people to come and serve on this task force. They all volunteered. This is a critically important problem, and because it's the highest in our communities and in our hospitals and in our borough, we really want to create a large, robust effort around solving that, finding solutions. And a birthing center does not solve everything, because Black women who have the highest risks very often have high-risk pregnancies as well because of underlying conditions. And so even if they don't give birth in a birthing center, what we feel is that it's important to have advocacy, to have support, to have coaching, to have adequate prenatal care with really excellent, physicians, and also to have an adequate postnatal experience where your mental health, your physical health, a lot of women have to go back to work right away because we do not have a mandated paid family leave. We are only one of 7 nations in the entire world that does not have that. Even on, third world countries have maternity and paternity leave that is paid and guaranteed. And, we are far behind. So, if you're not healthy, if you're vulnerable, if you've just given birth and you have to go back to work in 3 weeks or 4 weeks, you are significantly more likely to have complications that could impact your life and certainly your health, and subsequent pregnancies. So those are the things that we look at systemically, from a high level down to the micro level, with experts. And, over time, that consortium will grow. The borough president is committed in her desire to see a birthing center in the Bronx, if not more than one. There is one that is developing as part of a large private practice, and I believe it may be closer to your district than to mine. But in the end, what we hope for is a public health, public hospital affiliated community-based birthing center. That is our goal. And that at the very least would be a haven for education, support, counseling, health visits, training, everything that women need to really successfully navigate parenthood before, during, and after. So that's it. I'm so happy. Thank you so much for asking that question.
Thank you for illuminating that issue. I know that in the Brooklyn Healthcare Disparities Coalition, the issue of racial justice has become primary.
Yes.
One of the leaders in there around maternal health, Ngozi Moses, who runs the Northern Brooklyn Perinatal Network, has become a champion in that particular arena. And I unfortunately have not heard the same energy here in the Bronx around this issue. And I'm glad that you described the task force, but not heard the same energy around this issue that I've heard in other parts of the city, and I'm really happy. You mentioned several times volunteers. Mm-hmm. And I'm hoping that as people get educated on these issues and opportunities to volunteer, that folks can volunteer to be on some of the committees that the borough president has put together, some of the advisory committees for some of the healthcare centers, so that Community Board 8 it can be a strong and important voice in the context of the overall healthcare of the Bronx, not just the community board. It may be not the right time to go through it right now, but again, as you find opportunities for people to volunteer for these kinds of things, if you can make that available to us as well, and we will send that out to the members of the committee and to the community board in general so that people can become more involved in the issue.
Thank you. I appreciate that. I will certainly let you know. As you know, we are also looking for members to help us in the community advisory boards of the hospitals, the public health hospitals. I have applications still coming in. We need people for North Central Bronx Hospital, which is close on the border with your district. And we're also still recruiting for the Gotham facilities. So that's an important service. It's a community service to represent your community and to advocate and to be present when hospitals present what they are doing, what they are investing in, what the changes are, and really, disclosing to the public all the important information that they are mandated to.
We will make, I know that you made available to me some of those two volunteer opportunities. I didn't know if you wanted me to talk about them now, but I will make sure that they get out to the entire board so that folks here, not only here in the committee, but others in the community board can look at this opportunity as one that they could step into. And I keep using that word opportunity. A lot of people consider getting on these things a burden. This is an opportunity to take that number 62 and eliminate it as a number that refers to the Bronx, and to climb the ladder, so to speak, to make sure that the Bronx is receiving the proper level of health care that it really deserves. I'm going to sort of, and if you can stick around, I'd really appreciate it, but I'm going to sort of step into the next piece of the agenda, because I know that we're getting to a little bit of the time, and we've already done a piece of this already. What are the major issues that you feel a committee like this should be delving into? And I've already heard the issue of domestic and intimate violence, maternal health care, and race-based issues, and certainly healthcare disparities, addiction issues connected to the aging issues, and that goes along with your opiate issue. And then there's the overall issue of healthcare disparities, racism, and the systemic racism, and how it's built into the delivery of healthcare in the Bronx. Those are some of the issues I think we can begin to dive into and take deep dives in this committee. Are there any other issues that you would like to see happen in this committee over the next month?
Close down the Church of the Mediator in the Bronx, where that was a beacon for people who could receive food, and that church was closed. And I know Christ Church Riverdale is trying to help. Food insecurity in the North Central Bronx is a
Price is still providing theirs on Tuesdays and Thursdays. If you know of anyone who needs food,
you have to fill out an application.
they can just come. With KHCC does ask for data, like their zip code and that sort of thing, but they don't need to demonstrate anything else other than just show up, and they can walk away with, at least a day or two of food.
The amount of opportunities for food to meet the challenge of food insecurity during COVID have disappeared in great numbers across, not only across the country, but here in the Bronx. The doctor mentioned before Hunger Free America. I don't know how many of you are familiar with them, but they are dedicated towards ensuring that folks can have access to as many benefits that provide, while the fridges are important and the food pantries are important, what they ensure is that folks are getting regular benefits coming in, so that
Yeah.
it isn't catch as catch can, is that people can actually do real planning around the food insecurity issue. And the other big issue built into food insecurity is the fact that because people don't know how to, and you mentioned diabetes before, they don't know some of the ABCs of eating, of making sure nutrition is correct. Much of the healthcare issues, the chronic healthcare issues that were mentioned earlier on, are generally nutritionally based. And it's something that we can certainly take a look at as well through that lens, because one of our other pillars that we're supposed to look at is not only healthcare, but social service delivery as well. So that's something we can certainly begin to take a look at over the course of the year. And again, our hope is that this is not just a listening post, that this will foster some activism within the context of the community board. And this community board's connection to, and it's one of the reasons I thought it was important to bring Dr. Keck in, is this community's connection to the generalized healthcare issues that plague the Bronx. Are there any other, we've already given, a whole year's worth of stuff to delve into, and Dr. Keck's going to come back. Doctor, if I can ask an important question, and it was referred to before, some of DOHMH's data is
Yes.
generally borough-wide. I know that they do put out localized data. Is that stuff available to us?
Yes, I think one of the tools that we use frequently, that anyone who is interested in health disparities and outcomes, for not just for the borough, but for, every county in New York State, I would look at the Robert Woods Johnson County Health Rankings. There is some fascinating data in there that includes things like what you mentioned before, food-related illness, chronic illnesses, the trifecta of obesity, diabetes, hypertension, and cardiovascular issues. In some communities, there's one supermarket, there's like maybe 20 or 30 bodegas to every one supermarket. And in majority of the bodegas, there is no fresh fruit, produce, vegetables, etc. You have canned foods, sodas, cigarettes, and many other things that are actually quite bad for your health. Whereas in supermarkets, that's where you get at least some healthy produce that can sustain, your health. So that's important. Those are the kind of data that you actually find in there and in the community health profiles. So the Department of Health and Mental Hygiene has community health profiles where they look at, it's not really by zip code, it's by larger and catchment areas, but you can find your community and they show life expectancy. They show what diseases people die of, educational level, teen pregnancy rate. Do you know in some areas of the Bronx, the teen pregnancy rate is like 35% between 15 and 19 years old? That is a travesty. That is where a life is curtailed from its potential because someone who is a child has to raise a child. So there are a lot of situations where that information is really important. It gives you a snapshot of what the key issues and problems are, as well as some of the social, economic, and other factors that influence and create some of those problems, right?
So we'll be in touch with the Department of Health and Mental Health to try and get some of that data. Laura?
It's online.
Hi, thank you, Bob. I don't know, I have, an idea for an item that your committee might be interested in, but I could wait to new business, wait till your committee members are finished.
Okay, well, I think we're ready, actually ready. I got enough stuff to write up. And one thing is in my organizing code of ethics, never promise what you can't keep. So I want to be able to address the issues that we can address. We will hopefully be able to meet some of the challenge, bringing in the right content experts over the next period of time to be able to address some of these issues, and then really develop a next step process. it's not just to hear what's going on, but to develop within the context of the community board, and certainly in this committee, what the next steps might look like in becoming more activist, and I use that word again in an advised way, activist on some of these issues. And
Bob?
one thing I will tell you, this is not a sprint, this is a marathon. Yes, Laura?
I'm concerned about the social services, the local social services that I feel it would benefit if the committee looked at that. In particular, there are very inhuman conditions at the Van Cortlandt Motel, as was discussed in the Riverdale Press recently. I don't know how many committee members saw that. The Van Cortlandt Motel is now a migrant hotel for families, and the article outlined mold and bed bugs and just all kinds of health issues going on there. Motel, there's a provider that is in charge of the motel, and the Department of Homeless Services oversees all of that. And I think it would be helpful to invite them, whether they come or not remains to be seen, but our board should, I believe, interact with this local agency in CB8 and ask them to come. Last night, Assemblyman Dinowitz and Councilman Dinowitz talked about a visit they made to the motel where they also asserted that there were very poor conditions that could be alleviated with extermination and with other things. So that's my concern. If the committee could see that might work for the social services piece of health hospitals.
We will certainly put that on the agenda. I will reach out to you to get some more information about some of the contacts that we need to be able to
Right.
involve,
The
and
office,
how we can work more closely. Yeah.
right, the office has those contacts and would be happy. The other thing is, I appreciate that the committee invited DHS to discuss the future of the homeless shelter at 6661 Broadway. And I hope that as a social service, the committee continues to take an interest in that. The newest development is that there is talk of proposal possibly of the Community Board 8's first legal marijuana dispenser adjacent next door to the shelter. I think that this could be problematic, and I just think it's something to have on our radar, and I hope that you continue to interact as a committee with the social services piece. And that's it. That's all I want to say.
A good friend of mine, former city council person, Dharma Diaz, is now the deputy commissioner for DHS. I could certainly reach out to her and find out if she'd be willing to come in and meet with us on this particular issue. She's an alumni of one of our leadership fellowships, and as I said, a pretty good friend. So I will reach out to Dharma.
Great. I mean, we could talk more offline about that, and thank you.
We'll
It's
talk
doing an
offline
amazing
about
job.
this.
Yeah.
One of the, let me skip it, yes, Steve.
I just want to say that for future reference or outreach, I think this was mentioned in Dr. Keck's presentation. Bronx Health Reach has been working on disparate health outcomes, environmental, medical, for as long as anybody. And they're a very rich organization. I have to say I've lost touch over the pandemic, but I think that they would be a good partner, and they're usually willing to come and speak about what they're up to. But they are really a top-notch group, or were. So I can't recommend them enough. We've had them in the committee in the past decade.
I've had interface with them prior to, and also I'm going to be meeting with Marcus Crespo over the next couple of weeks to find out what Monty is thinking about all this and how they'd like to be able to present and come and speak to our group as well. So that's another piece that we'd like to put on the table. So,
The Bronx Health Link?
The Bronx Health Link, yeah.
Yeah, they came and presented at SCREE. Are you talking about something else?
Bronx Health Reach, it's a different
Health
organization.
Reach,
different
Bronx
thing.
Health Reach, I think.
Bronx Health Link is a
Yeah, I know. that.
consortium of healthcare delivery systems. Bronx Health Reach goes beyond that.
Reach is
Uh,
racial and ethnic approaches to community health. And they are a core member of the Not 62, and we work closely with them. They are an amazing organization. So your member was correct. They're amazing.
So we're real interested in bringing them in. As I said, I think we have a really full agenda for the next year. On the new, the next thing is old business. I don't think there is any old business, not for me because I'm new. And for the new business, we are looking for a co-chair. So if anyone who is a member of this committee is looking to step up and become a co-chair on this rather, I would say, ambitious agenda for the next year, I certainly would be more than open to that, and that would be helpful. I understand that people might not think about it immediately, but it's something you can certainly put in, tuck away into your mind, and it's something that you certainly can speak to myself or someone at the office here to say that you're interested in being a co-chair of this committee. One other thing is we are ostensibly supposed to meet the second Wednesdays of every month. I know that in November, I believe in November and December, I will be traveling the second Wednesdays. My job has required of me to take a lot of international travel during the next several months. Second Wednesday of November, November 8th, I'll actually be in, tough luck for me, I have to be in San Juan for the Somos Futuro Conference. Work very closely with that organization. And then the second Wednesday in December, which is the 13th, I will be leading a group of Brooklyn leadership to Israel and to the Palestinian territories. So I'm going to have to find some other dates. I'll work with the office to find different dates during those months. December, because of the nature of December, we might have to skip a month. It's just a very hard month to find times in, but we'll see what we can find in November. We will, I will work with the office again to get these notes together and see what would be the next step, next issue that we'd like to be able to really take a look at. I have a proclivity. There's two proclivities that mine, and I'd love to get some feedback from you guys. One would be bringing in someone to talk about the issue of maternal health care here in the borough. I know that we've had recently someone, but I'd love to be able to take a look at that again. And the issue of domestic and intimate violence. Dr. Keck and I mentioned, Margaret, you have some folks that you're connected to as well. Just by the passion you've shown towards the subject, if you can make some recommendations, perhaps on the issue of intimate and domestic violence, it would be extremely important. And we will try and get someone, again, to begin to more fully unpack these individual issues for us at the upcoming meetings. And that is, as I say, that's all, folks. That's at least for this meeting. I know that's a light thing to say. I want to really deeply thank Dr. Keck for giving us. I'm waiting to see what the deep dive looks like. But I will get all the various different pieces of information and links to all of you. Brett, you have a question.
Yeah, I just wanted to say something really quickly. Can you hear me?
If you can fully identify yourself, please.
Sure. So I'm a member of the Community Board 8. I'm from Community Board 8. Would you like you want me to turn on the camera?
That'd be nice. Yeah, love to see your face, smile.
All right. My camera is not connecting. I apologize.
Yeah, let me see if I can get you connected. I
Okay.
had to do something before. Lower hand.
Um,
No, it's not. Nope, it's not connecting, yeah. All right,
All
Brett,
right,
we're just gonna have to do without your smile.
all righty. I'm sure it'll be quite a loss. Um, so since this is about, public health, and I just wanted to bring up an issue that I had to go away from the commuter for a second. Maybe this was mentioned, but I wanted to mention before everybody leaves. I don't want it to. So there's that there's a contingency of young men in this country and in broader parts of the world that the Japanese refer to them as hikikomori, or the not educated, employed, or in training. And largely, a lot of these young men are invisible because many of them just stay in their rooms. They don't go outside. They're not interested in working. They're not interested in going to school. They're not interested in even dating women or having any kind of relations with women, and just seem to lack an interest in participating in society. And it worries me because not only are they not contributing to the economy, a lot of these men have problems with autism. They have problems with schizophrenia, a whole slew of mental issues, and many of them, yes, many of them just they have different mental issues, and I think it's a part of a broader problem, but it's just something I wanted to put it on your radar. Thank you.
If I'm hearing correctly, tell me if I got it right, is that the issue of the chronically unemployed and folks who are encountering mental health issues that often prevent them, because of these mental health issues, from fully participating in robust life and the context of connectivity to other folks in society. If I'm getting that correct, right, Brett?
Yes,
Thank you so much for
I
bringing
do
it
think
to us.
that mental health is a very, very large portion of it. You're very welcome. I'm glad that that you listened. I think that mental health is a part of it, but I think that this is also a part of being in the age of the internet. A lot of these men, they stay home and they just browse the internet, watch porn, and play video games all day. You know, it's to be frankly honest.
Hear you loud and clear. The issue of, listen, an overriding issue, obviously, and Dr. Keck mentioned it before, is mental health. And mental health is a plague in our society. The lack of access to mental health. A number of years ago, working with Ostos Community College, the Center for Bronx Nonprofits, we ran a conference on mental health in the Bronx. And I'll remember today and probably forever, is that the first time many young men see a mental health professional in the context of their lives is in handcuffs. And it's not because they necessarily have a criminal proclivity, it's because they have untreated mental health that often causes them to become involved in criminal lifestyles. And put that up with the issues of racial injustice and systemic racism. The fact is that in this borough, I believe there are 7 communities in New York City that provide the majority of populations for jails and prisons in New York State, and 7 of those communities reside in New York City, and I think 3 are from the Bronx. So the issue of mental health and young men in particular is a huge, huge issue, and it's something that certainly will add to the agenda. Frankly, I work with a number of groups around gun violence around the city. In particular, I work with someone named Pastor Guilford Monrose, who's the Director for Community and Faith for Mayor Adams. One thing I think I left out in my opening statement about myself, I'm also one of the commissioners of human rights in the city of New York. So I work very closely with the Adams administration, and Pastor Monrose and I have been working on the issue of gun violence and young men, in particular in Brooklyn. It's certainly an issue here in the Bronx, and something that hopefully we begin to approach. Don't believe that we will begin to really find ultimate solutions, but understanding leads to solutions, and hopefully we become more educated and more connected to these endemic issues. That going back to that, the opening statement by Dr. Keck is that the Bronx is 62 of 62 counties in healthcare status in the state of New York. So can I have a motion? I don't know if we have a quorum here, but we'll take it anyway. We have a motion to adjourn.
Motion to adjourn.
Everyone in favor? We're ready to go. I want to thank everyone for joining us tonight, and in particular, I want to thank Dr. Keck for leading us through a very, very intricate and important discussion around healthcare in the Bronx, health and of course human services in the Bronx, and we will do our best to do our best. Thank you.
Brett, I have a question. You used a term earlier. Can you repeat that term that you used to describe?
So there were two terms that I used. One is one that the Japanese started using in I believe the mid-90s, around the mid-90s, which is hikikomori. I don't remember how it's spelled.
It's okay. I'll look it up. I just wanted
Hikikomori,
to.
and the term that we use here in the UK. Okay, yeah, and the other term was NEET, not employed, educated, or in training.
Wow.
Okay, thank you for clarifying.
Thank you all very much, and
Night.
we will. I'm looking forward to working with you all as we move this agenda forward. Good night, everyone.
Good night.
Good night.